So today what I'm hoping we can do, one is check in on the seed workshops that I mentioned, I introduced on Tuesday. I'll pull up the document so that you can see the different options for some trainings and see if that's something that we want to do as a class. Give you a quick update for next week. So we'll turn our attention next week to really focus in on developing the script and the questions for the key informant interviews, essentially our whole plan for conducting the key informant interviews. So that's what we'll work on next week. Hi, Taylor. Welcome. So I just kind of wanted to give you that update. I did go ahead and post resources for next week. There's really just one that I want you to read and focus on and take notes. It's about conducting key informant interviews. And so as you're reading it, I'd like you to sort of be taking notes on how these different aspects might apply to our project. So it's everything from designing the questions to recruitment to designing the rest of the script, so a whole sort of plan. So if you would sort of do that for next week, that would be great. So before we jump in, let me just share my screen and show you the workshops that I was talking about, just to see if this feels like something that we would like to take advantage of. All right, can you all see the workshop overview? Is that what you see? Okay. All right, so as a reminder, these are student-led workshops. So that's meant to be sort of a peer experience. And there are different topics. So you can see the co-facilitation is by peer educators. And it's, the participants are meant to be students. You can see discussion and dialogue and interactive activities meant to really support self-reflection, learning from one another, and building skills. So they usually require an hour and a half, so we could see if they could fit it into, a class period. But here are the workshop topics. Let me move my chat out of the way so you can see them. So everything from intro on social identities, bias awareness, privilege and oppression, allyship, dialoguing difference, and this empathetic and effective listening. So any thoughts? I don't know if anybody reviewed it before class, but any thoughts that you had on whether this feels like it would be a worthwhile endeavor? And if so, which of these topics might feel most relevant for the work we're doing?
Are we supposed to choose, do you know if it's set up for us to just choose one topic for the entire workshop to encompass?
I believe so.
Okay.
Mm-hmm. We could certainly ask if there were a way to infuse aspects of multiple, but I believe that's how they're meant to be set up. I'll scroll down just in case you want to see those last ones. Okay, yeah, listening, dialoguing difference. Maybe one thought I did have was around the empathetic and effective listening, in terms of us kind of starting into the process of doing some key informant interviews. I always think the dialoguing difference, that notion of engaging in dialogue across difference is something we always can benefit from. Some of these maybe aren't quite as relevant, but are also important, the allyship and thinking about that process for engaging in allyship action. So maybe what I'll do is I'll do a little poll. Bree, would you mind, maybe we can just set up a quick little Google form that you can kind of vote on. Maybe it's 2 questions. 1, should we have one of these workshops? And 2, if so, which one? And then we can kind of decide from there if there seems like there's some consensus. Will that work? Okay. All right, I'm going to stop sharing. Perfect. So today, anything else before we kind of jump in for today? Okay, so today our hope was to really delve into learning more about the quantitative data that might exist, that we might be able to access and use to inform our community assessment. As I mentioned, we're going to have some various guests being in and out. Taylor, are you on right now? Oh yeah, asking about the timing. Thank you, Rachel. She may have stepped away from her desk or wherever she's working today. So the way that I think about the quantitative data is, in some ways, depending on what data exists, that might inform what we want to ask in our interview questions. I think it can be sort of a both and. It can both inform what we want to know, and we can also identify some questions apart from what exists in the data. So the other thing I mentioned is that Summon is going to be joining us. She works with the health district on their evaluation team and has some surveys. And Kat, I was actually thinking, I'm pretty sure you were in 550 the semester that we worked with the health district and sat in on the listening sessions and did the qualitative data. I think that's some of the data she's going to present today, is the data that you worked on collecting and analyzing in class the year before last. So you might be a little more familiar with that data. I suppose the other thing that we could check in on is if anybody had any initial thoughts or edits on our goal and where we're at with the goal. We can certainly revisit it on Tuesday, but if we have a few minutes, I'll just pause and see if anybody else had any thoughts. Yeah, Kat, actually Morgan was not, right? Morgan, you were in 550 just this last semester. But Bree,
Why did I think you were in that class, Morgan? Could have swore you were.
I don't know. I'm everywhere.
Bree, you were though also. That's right.
Okay, I got 1 out of 2 right.
So any thoughts yet on our overarching goal, the wording, anything before we make any edits? I'm going to put it in the chat, what it was or what it is. Okay. Here's our current draft. Hi, Rachel, welcome.
Hi.
We were just reading something that I put in the chat. That's why there's nobody talking while you jumped on.
Okay.
So let's kind of just keep that in the back of our minds, keep mulling it over, see what might be missing, if there's some word changes that we want to make, and we can revisit it depending on the timing today and or for sure on Tuesday. It's posted under this week's module so that you can access it. All right. So Rachel, welcome. We haven't met before, so it's nice to meet you.
Yeah,
Taylor,
it's nice to meet you too.
it sounds like Taylor's having some technical issues. No problem, Taylor. So Rachel, I'm wondering if you would be willing.
Can you hear me?
Yes.
Okay. Interesting.
Can you hear us? wonder if she can. No? Okay. Yeah, I don't know if she can hear us. I can text her. Okay, you can hear us. Okay, great. Well, we'll just kind of get started and see if you can, we could hear you, but oh, if you talk, you can't hear anyone. Got it. Okay. Well, you just hang out and yeah, Hannah says we can use the chat. I could also call you if the audio is the issue, put you on speakerphone, and we can do it that way. So we'll make it happen. But Rachel, yeah, I'm wondering, so first, do you have a little bit of an overview of what we're doing and who this class is? Do you have some of that background? No, okay.
Not quite.
Okay. No, that's okay. So I'll give you a quick overview and then we'd love to kind of hear from you. So we are one of the Master of Public Health classes at CSU. So everybody in the class is a graduate student working on, well, 12 out of 13 are graduate students working on their Master of Public Health degrees. We also have one student who's working on her master's degree in health and exercise science. And the class is called Health Promotion Programming. And so in the past, it's been a class that goes through the process of programming. So we talk about community assessment, we talk about program planning and design, implementation, and evaluation. And for the past couple of years, I've really wanted to shift how the course is taught to make it a much more engaged experience for students, rather than sort of keeping it theoretical, to actually engage in something that's meaningful and ideally helpful to community partners. So this semester, we have been working really closely with Taylor and with MJ to essentially design and implement a community assessment for folks experiencing homelessness to see, yeah, sort of assess community priorities, assets, needs, the status of the community. And so the first part of the semester, you know, we started with really learning more about homelessness, learning about homelessness from the public health perspective, really taking a root cause analysis as we engaged with materials, speakers, and whatnot. And now we're into the process of examining what data currently exists, and then what information can we collect through some key informant interviews. And so part of, I think, your role is the HMIS data. Is that how I understand? So part of what I think we're hoping to learn from you is what data exists, and whether and to what extent we can analyze any of it or support efforts to analyze it, and how we might use it to inform our key informant interview questions.
Oh, that's awesome. So I think if it's helpful, I can kind of give you a little bit of a background on what I do for HMIS and kind of what HMIS is. I'm not sure if people on this call are super familiar with the HMIS system, but I can give a quick overview of that if that might be helpful.
That would be really helpful, because I think we don't have I think we have a very, like, you know, big picture understanding. So some of those details would be super helpful.
Yeah, sure. So HMIS is actually, so HMIS stands for Homeless Management Information Systems. And HMIS is actually a set of HUD data standards that they put on organizations in order to receive federal HUD funding. And HUD stands for Housing and Urban Development, and HUD funds a lot of projects like permanent supportive housing. And so I don't know if anyone here is familiar with the complex like Red Tail Ponds or the new complex Mason Place, but those are permanent supportive housing complexes that are federally funded. And the way that HMIS works is that if you are collecting HMIS level data in your community, then you can show the need for that funding to HUD, and they will allocate resources to your community. And so because HMIS is the HUD standard, you're required to use it. if you are operating in a continuum of care and receiving that funding. And so what I do with my boss Scott is we manage the system. And so your community can choose the platform that you use to collect this data. It just has to be an HMIS compatible software system. So in Colorado, we use a platform called Clarity. It's hosted by BitFocus. So this is just a data software company that they're a vendor, and so they contract out with continuums of care to provide this platform so that we have a space to collect this HMIS data. And HMIS is client level data. So anything that we enter into the system has to be tied to a client. And so the types of fields that we collect, some of the HUD fields that are required to be collected are chronicity. And so chronicity is measuring someone's chronically homeless status. And so if you are, there's a series of questions, and it's an algorithm that produces a yes or no, whether or not someone's chronically homeless. And that's a measure that communities are measured on, is the number of people who are experiencing chronic homeless in your community. And basically what that means is that somebody has been homeless for 12 months or longer in a period of, I believe, 3 years. So that is one of the primary, one of the main data elements that we collect, in addition to very basic demographic information on clients. So we collect race, ethnicity, gender, age, all of those very basic demographic questions, and then chronicity, and then disabling conditions, monthly income, whether or not the person is receiving any sort of non-cash benefits and health insurance. We track that as well. And so that's kind of just a quick overview of what we collect initially from the client when enrolling them into one of the programs that is in HMIS. And so basically with the HMIS software platform, some of the main data points that we're tracking, in addition to just these fields, is we're trying to see outcomes. What are the outcomes that we're seeing with our clients? And so we want to be able to measure the number of people that are moving into permanent housing after being enrolled into our programs, collect all this information from them, and then track their progress is what we're doing in the system. And so tracking their progress related to housing, related to changes in income, related to access to healthcare, related to access to different agencies. And so I don't think I've touched on this yet, but in Colorado, we are sharing one platform. And so I'm sorry, I just see that someone's talking in the chat. By we, do you mean you and Scott, or our partners, healthcare systems, entering this data? As in, who is inputting this on a day-to-day basis? Really good question. So yeah, we as a state, the state of Colorado, we share one instance of HMIS. So when I say we are entering data, I mean the whole state of Colorado. If you're a homeless service provider receiving this federal funding, or if you just want to participate in HMIS. So for example, Homeward Alliance has 3 programs that are required to use HMIS and enter that standard of data. But we have, at Homeward Alliance, we have about 10 programs. So we're entering all of our program data in there, but only 3 of the programs are required to enter that data. But because we want to provide the community with a more whole picture of what homelessness looks like in Northern Colorado, we choose to enroll all of our clients into the system, anyone who's experiencing homelessness. And so I think at Homeward Alliance, we have about 30 end users. We serve about 2,500 clients a year. And then there are another, I think, 10 to 15 partner agencies in Northern Colorado who are entering into HMIS. And Scott and I are in the process of onboarding new agencies on a regular basis. That's kind of what we do, is we support the agencies who are entering into HMIS, and we also work with onboarding new agencies so that we can get as many homeless service providers in the community as possible entering data into the system. So like I said, it would be the more partners we get entering to the system, the more complete the picture is. when we're extracting that data, producing reports for the city, et cetera, the more data we have in the system, the more accurate those reports are going to be. And so there's 4 continuums of care in Colorado, COCs. So Northern Colorado is one of them. There's also one in Denver, which is called Metro Denver Homeless Initiative. And then there's Pikes Peak, which covers Colorado Springs and I believe El Paso County. And then there's the Balance of State, and the Balance of State actually covers the rest of Colorado, which is a lot of rural areas. And so all of these COCs are collectively attempting to get as many partner agencies entering into the system as possible. I think I was also, talking about how what I believe our federal funders and our state funders are wanting to see is what are we doing with their funding, and how is it helping us move the needle on ending homelessness in our communities? And so how quickly are people getting into housing from the time that they enter one of our programs? So that's something that certain programs are measured on. How quickly are or how long are people staying housed? You know, if we do get them into a permanent supportive housing, or we get them a housing voucher, how long is that client staying housed? And in addition to that, are we making sure, or are we measuring that people are not falling back into homelessness? And if they are they falling back into homelessness from one of our projects that's in the system, or are they coming to our community, and are they were they homeless before coming to our community? And then I guess the third thing would be, are they falling into homelessness and they have never been homeless before? So kind of just getting a good idea of how people are falling into homelessness as well through the system and the data that we have there. I think something that Chrissy, that you mentioned is how can y'all as a class help maybe analyze some of this data, or I think you talked about collecting assessments. I'm not super sure what that would entail, if what kind of assessment you guys might be wanting to collect to analyze. But just an example of different types of assessments that we collect is we have like a vulnerability index assessment tool that is used to measure vulnerability so that we can best prioritize people for housing. We're also currently at Homeward Alliance right now. I don't know if Taylor mentioned this, but because of COVID, we're also trying to collect as many assessments as possible that will tell us who's eligible for a vaccine based on their age and risk conditions, and as well as tracking who has had the vaccine. So that's something that we're able to do in HMIS as well, just so we can have kind of an understanding of where we're at with the people that we're serving in terms of how many people have been vaccinated, how many people still need to get vaccinated, and who is not vaccinated because they don't want the vaccine versus who is not vaccinated and they do want the vaccine. So assessments like that are things that we can build out in HMIS, and all of this data is voluntary. So all of the data that we're collecting from clients is voluntary. We do not restrict access to services if somebody does not want to provide us with this data, or if they don't want to be entered into the system. So yeah, that was kind of a long overview. I'm not sure if that was, I'm hearing the HMIS data may be more region specific, Northern Colorado, than county or city specific. Is this right? Would it be difficult to zoom in on Fort Collins to get a comprehensive picture? So it is, so basically what the system can do is we can run reports on the entire state. We can run them per continuum of care, or we can run them per city if we wanted to. So you can really drill it down to like however specific you want it to be, because with every program and every program and every agency that we set up into the system, they have a code associated with them that puts them on a map. Basically, it's called a geocode. And so we can definitely drill it down to just Fort Collins if we wanted to.
Getting around.
Welcome, MJ.
And I will say, as a continuum of care, we have not yet partnered with anybody in the capacity of providing them with data and having them analyze it for us. I think, I don't know if y'all have the history of Northern Colorado, but we just became a continuum of care less than a year ago, I believe, or about a year ago. And so there's no, yeah, we haven't really explored this yet with partner agencies to analyze the data, but I know that Metro Denver is kind of exploring this right now. And because we have our data is state level, we would we have access? Because our data is state level, we would have to kind of decide as a state what data we'd be, as a state would be willing to share and extract to provide to partner agencies so that they could analyze it. Would we have access to that geocoded as a private information? And that kind of is along the lines of what I was just mentioning of we have not yet ventured into this territory of providing other agencies with our data so they can analyze it. So the geocode, I mean, if and when we are able to provide you with the data, I'm sure we could share the geocode information with you. It's just a location tag is all that is to show where the service is or where the client was enrolled in a program.
Rachel, is there a way of like, I'm thinking that it could potentially be a nightmare of red tape to share data. And I'm just wondering about like, is it against the rules as me as a user to be running reports on programs and assessments that I'm collecting and then using students, interns, volunteers to help
Analyze.
analyze? Is that a way around it?
Mm,
Or would it still have to be?
Potentially, I think it might depend on what you're extracting, Taylor,
Okay.
and what is being analyzed, because there's a lot of PII, personal identifying information,
Right.
that is really kind of never supposed to be extracted and shared.
Mhm.
And that's just, and so if there's a way that they can analyze the data with just the, I guess it depends
De-identify.
on, yeah, it depends on what they want to analyze. So yeah.
Yeah.
Potentially.
So like if we were to like, let's say as an example, I ran that report today about vaccine assessment and it's got, you know, race, ethnicity, but nobody's names or anything like that. Do you think that would be something that I could de-identify things, send to this group and be like, run some crosstabs on this? What do you think? Like, I don't know.
Would it be aggregate data?
Yeah.
I think that would be fine. But I don't want to, I'm saying I think because I don't want to say anything like
Yeah.
for sure. But let me follow up with
Okay.
some other HMIS leads and see if that would be okay.
Because I think at this point we're talking about doing more of a qualitative analysis to get started by doing like key informant interviews or focus groups or stuff like that, just to talk with people about their experience with health and this community. And if we were to, I don't know, at a later date, come up with an assessment that's more quantitative, then I think we would be into that area of talking with HMIS. But
yeah,
Rachel,
I think.
Sorry.
Hi, MJ.
Hi. It's been a minute since I've seen you.
I know. I don't think I've seen you since I saw you in person, which so long ago.
It's been so
a lifetime
long.
ago.
I still want to build that reentry program whenever you're ready. And so
I don't know if you can tell, but I've moved jobs since then.
whenever you're
Be
ready.
happy. Yeah.
I'm wondering if we can do this similar to how we've done with Fuse and assign folks a unique identifier and pull their date of birth and their name out of the picture, so we can maintain their age, but not those pieces that
Yes.
tie us
Yeah.
to them, and then be able to do more of this quantitative analysis that way.
I think that would be good. And is that how I wasn't involved in the Fuse data analysis? Is that how it was done with Fuse? As data was extracted from HMIS?
Yeah.
Okay.
And I can
Nice.
send you the reports that we've used for Fuse to give you a better
Mhm.
picture of what was pulled, but I do think that's probably the most streamlined way of doing it, in that I've seen it work, which
Cool.
doesn't mean that it's streamlined, but
Well,
replicate.
I think that would be a really good guide to go off of, is like if we know that this was done with Fuse from HMIS, then we'll stick with some of the same parameters, and we should be in the clear.
Cool.
Any other questions so far coming up for you all for Rachel while I'm here?
She knows it all, so anything related to data and homelessness, I think.
Yeah,
Just-
Rachel, would you
Actually-
speak just for a couple minutes on sort of your background and your route to,
Yeah, I was gonna say, I was like, actually, I've only been in the HMIS position since December, so I really don't know it all. But yeah, I worked with Homeward Alliance for since 2016. And I've really worked almost every position within the organization, from doing frontline work with direct service case management to program director and program development and supervision. And then most recently is I've acquired this role as the as an HMIS specialist system admin for Northern Colorado. And I think really what well, first of all, this is a new position to our community. So when Northern Colorado formed its own continuum of care, we had to identify an HMIS lead agency, which became Homeward Alliance. And then from that, the lead agency, the HMIS lead agency, has to employ an HMIS lead team that provides HMIS support to the entire community. And so we hired for this position, I believe, in March of 2020. And we had an HMIS lead in this position for maybe six to 7 months. And then she had to depart the organization, and we hired Scott, who's my boss now. And with all of the, I'm not sure if you guys are familiar with the ESG CV funding that came about because of COVID, but I think it was millions and millions of dollars that were distributed at a state level and then at a continuum level in response to COVID-19. And so when that funding came about, it allowed us to hire a second staff person, which was me. And really because we had to quickly set up agencies who were not previously using HMIS, or maybe these programs were new to them, to get into the system quickly so that they could start implementing the funding that they received due to COVID. So yeah, I have the really fortunate opportunity to be learning from somebody who's been in the field for 20 years. So Scott is he is the HMIS manager for Northern Colorado, and he has been implementing HMIS in communities for 20 years. So he has a wealth of knowledge, and he's been teaching me since I started in this role in December. Does HMIS have any maps or data that are publicly available to the general public? So I can send y'all maybe a couple of examples. So because we've just formed our own continuum of care within the last year, we're still working really hard on getting as much data into the system as possible. And then we're thinking maybe this summer or closer to the end of the year, we can start working on some dashboards, some data dashboards for the community. I think right now our focus is getting as much data into the system as possible so that when we do start developing those data dashboards, they're as complete of a picture as possible. And so those dashboards will be available. We'll start posting them on our Homeward Alliance's website, on the Continuum of Care's website, and they will be powered by Tableau. I think we'll also actually start providing to the city. The city of Fort Collins requests a number or a data point from us that they can put on their data dashboard portion of their, I think it's their social sustainability portion of their website. And so it will be, all of that data will be coming from HMIS. But there are, I can send you guys some really cool examples of communities in other parts of the country who are publishing some really awesome data dashboards. I was exploring available data on AEH in Fort Collins. It's much easier to find criminal data on the population, not more humanistic data. Very disturbing and interesting. Yeah. Yeah. What is, I guess, what websites were you looking at for that data? Just curious.
I was just on City of Fort Collins Open Data, and they have a little search bar, and I was searching, and it's just very interesting that criminal information is very public information. So as soon as someone has been charged, that information becomes public. But there's not a lot of humanistic data, and it's just interesting that we would not want to put more humanistic data out there to these populations, and instead it's much easier to find data on a specific population as criminals. And so that was very disturbing and interesting, because if someone was doing research on this population, it's easier for them to find the pathway towards criminalization of this population than it is to find a pathway of putting humanistic characteristics on the population.
Yeah, absolutely. I agree. And that's actually what I was doing before I was in this role, as I was working with a reentry program where the program provided services to people who are getting out of state prison. And it was very interesting and frustrating having to work with some of the entities that are simultaneously or that are intertwined with what we were doing. And yeah, if you look at the City of Fort Collins, I think it's the Larimer County Jail website, you can see the second someone's arrested, what they were arrested for, and then there's the breakdown of the current inmates, whether they're homeless, transient, or housed. It's just a pretty it's not very useful data, I don't think, what they're displaying. And the data that we had access to, or that we have access to, and the questions that we ask when providing services to people who are involved with the criminal justice system, it definitely gives you a more full picture of, okay, there's a trend here. This might be, because of all of these factors, these people were a lot more likely to become incarcerated or start being involved with the criminal justice system. There's trends here, and that's what I think a lot of the organizations that provide services to those individuals, that's what they're trying to gather. And if you are interested, I would say CCJRC is it's a really awesome organization. They're based out of Denver. It's Colorado Coalition for, oh my gosh, I've been out of it for so long. It's CCJRC, and it stands for Criminal Justice Reform Coalition. Yes. And they actually lobby at the state level for funding for community organizations for people who are getting out of prison, and they do a lot of really good work, and they produce a lot of really good data on their website. And there's I think through that website you can look at links to what they're doing to help community partners address the criminal justice system in Colorado. Sorry, this is a tangent. And this is what MJ might have been talking about at the beginning of that reentry program is, yeah, I think Homeward Alliance has a lot of programs that are dedicated to serving that population. And so I think we're all collectively pretty passionate about it. So don't, if you bring it up, we'll definitely go down that path.
I wonder if it would be interesting if there was any political push to have organizations like the city of Fort Collins within their available data within the city to have to put a section that is more humanistic towards truly understanding the full scope of a population and not simply the criminal aspect of a population. Because I think that could be, it's just very interesting that as a society we decide that once you have been qualified as a criminal, that's public, but a lot of your other life story that could have impacted, you know, that behavior is not shared. So I don't know if that would be helpful in any way to provide data resources that are I'm forgetting the word, not identifiable, but that would give individuals who are doing research on this a much better view of the population they're working with.
Yeah, I'm not sure that what kind of conversations have happened to encourage more holistic data to come from those entities. But yeah, really all you get to see is what crime they committed and when, rather than like what are the root causes of why somebody committed a crime. So yeah, it's very interested. And I'm sure, as you all know, homelessness and incarceration are extremely intertwined.
All right. Well, Rachel, thank you so much for your time. I think we'll probably have some follow-up questions if that's okay. One, I'm thinking about, for example, right now on Tuesday in class, we had a really important conversation around language. And so I think that would be a question is, do you collect folks' primary language as one of the variables in the system? And, you know, just thinking about who doesn't get input into the system. So, but maybe we could plan to, if you're comfortable or you're okay with us following up with you via email with a few of our follow-up questions. Would that be okay?
Yeah, absolutely. And I think MJ is going to send me the Fuse example, and I'll just take a look at that and make sure that everything within that was extracted from the system then can be extracted now with no problem, so that I can take that back and analyze it.
That sounds great. Well, we really appreciate your time today and willingness to jump on and give us an overview and a little bit of your background and whatnot. So, and you're welcome to stay. We have a couple other folks where I'm just like looking for the Zoom squares. Simon, I can see that you're here. Welcome to class. And there might be someone next to you.
Yeah, Maria is joining as well. I think she knows you.
Perfect. Hi, Maria.
Hi.
So I think we'll switch gears just a little bit and hear from the two of you about some of the data that you might have that we might be able to access and build on. But any other last questions, comments, thoughts for Rachel? Again, you're welcome to stay on, Rachel, but we won't take any more of your time than you want to today.
Yeah, thank you. I appreciate you for having me. I have to jump, but
sounds
good.
Thank you
so much.
Yeah, we'll follow up via email, and thanks again for your time today.
Yeah, thanks. Have a great day.
You too. Thank you. All right, so I think we'll turn it over to the two of you. Would you mind giving just a quick who you are, what your role is, and then we'd love to just hear a little bit about the data. I actually think there are two students in this class that were in my class a year and a half ago when we helped with the data that I think you're going to talk to us a little bit about. So there's a little bit of background knowledge from a couple students, but yeah, if you wouldn't mind a little intro to start with, and then we can delve into learning more about the data you have.
Yeah, so my name is Simon Mather, and
I'm Maria McPherson.
yeah, and so we both work on the research and evaluation team at the health district. So I know you've been working with MJ, and they've probably shared a little bit of information about what the health district does. But we essentially do. It's all gone, it's all changed a lot in in the time that we've been in this class. But so essentially, we try and make sure that we are using data to inform the programming that the health district does. And we do that in a few different ways. So the first is internal program evaluation. So we have a number of programs at the health district that provide direct services to people, and we want to make sure that we're evaluating those services to make sure that not only are clients happy and satisfied with the services that they're receiving, but we do try and measure some level of outcome, and in certain cases we try to level some level of community impact to make sure that those services are actually meaningful and helpful to the community as a whole. So that's kind of one realm of what we do. And then the other piece of what we do is this community data level or community data piece. And so we essentially do a triennial community health assessment. And that is done once every 3 years officially, but we, with COVID and just sort of with the priorities of this community and of Larimer County and other organizations, we are thinking of adjusting that timeline so it's a little more flexible and fluid to needs and global pandemics. But we actually have a couple of pieces to that community health assessment. So one of those is in conducting community discussion groups, which it sounds like some of you may have been a part of in fall of 2019. So we convene different groups of people and essentially try and hear what they believe the biggest community issues are. And it was really great to have some of you guys involved in that process in 2019. And a lot of the things that we learned from that have definitely stuck in my mind. But then the other component to that is a qualitative survey. So we conduct a population level survey of adults living in Larimer County. And I actually do have some slides that I might just share. So to give you a little bit of an overview of how that works. I won't take too much time because I know some of you have probably heard this spiel before, but I think it does sort of help illustrate a little bit of what is going on with that. So community health assessment, important part. We want to do a community health assessment, and we pretty much focus on primary data collection, though we supplement with a lot of other secondary data sources. So the survey itself, our last survey was in 2019, and then actually we did a follow-up last summer. We wanted to make sure that we were understanding what changes were happening in the community as a result of the COVID-19 pandemic. So we essentially resurveyed everyone that had previously participated in our survey. The survey itself is really meant to kind of capture a broad view of what population health is. So we're essentially trying to measure the health of the community of Larimer County at large. And there are a couple different models of how you can actually assess this. This is sort of one model of how, what factors actually contribute to population level health. And you'll see it's a combination of lifestyle and health behaviors, the physical and social environment, your actual access to medical care and the quality of that care, and then some genetic components. And we, this is a lot of information. So we do the best we can to distill what we want to figure out to questions that we think are most pertinent to our community and that we think can best be answered through a survey type like the one that we administer. So essentially our topics do try and run across the spectrum. We also ask about policies because one of the health district priorities is in trying to advocate for and against certain policies. So we try to really ask specifically about policies at a local level. And then again, we want to make sure that we're collecting some demographic information to help us, figure out what is going on with specific subgroups or certain parts of our community as a whole. And this is just kind of a little bit of an overview of the questions that were asked on our follow-up survey in 2020. So the things on the left are questions that we asked in our 2019 survey that we felt were important to repeat. And then the questions or the topics on the right are things that we added that were specific to the COVID-19 pandemic. And we also felt were some of the most important things for us as a health district to have an understanding of, and also things that we had heard from community partners were really important to them to understand what was happening at the local level. So one thing I do kind of want to talk about and address, particularly with this class, is one of the limitations, well, it's sort of a strength and a limitation of our survey, and that is actually the sampling and who is actually part of this survey population. So you probably have heard me say adults in Larimer County a few times, and I want to kind of walk through how that might not be the most precise language to use with this, and sort of talk a little more about how the sampling works and some of the limitations of that. So our goal for the survey is to get data that is truly representative of Larimer County adults at large. And so in order to do that, we have to basically take a random sample of this population and then do some statistical work to extrapolate that data to the population at large. But in reality, we aren't able to, because of the method of our survey, which is we essentially take a list of addresses, because that is the most comprehensive list that exists out there that we have access to. We really end up looking at a list of adults with a Larimer County address, and to be even more specific, it's adults with a Larimer County residential address. So obviously excluded from this right off the bat are people experiencing homelessness who may not have a or often do not have a residential address. So, obviously that is a major limitation of our survey. Also, people living in other sort of institutions or non-residential addresses are not captured by the survey. And that is something that I do want to be upfront about. And it's something that I individually, when presenting this data, need to be more careful about when talking about what these findings mean for the county. So like I said, we basically, the method of our survey is that we mail people a survey. They either fill it out on paper or they go online to fill it out. And because so much of what is known about people living in Larimer County is based upon address. So when you think about the census, they basically go through and enumerate by address. There really aren't like comprehensive listings of email addresses bound to a certain geography. And that's why so much of this is wrapped around addresses. And then, like I said, we take a random sample of households. We have started to do some stratification in some situations where we actually oversample people if they live in a certain geographic area. So we know in Larimer County, there are some census tracts, which are, a geographic unit where more people of color might live. And we want to make sure that we're getting adequate representation from those populations. So in those census tracts, you actually are slightly more likely to actually receive a survey in the first place. And we hope that that translates to that population being adequately represented in our final respondent population. And so this question on the right is like, what keeps us up at night when it comes to actually getting this data collected? And when we do our like back end statistics, like this is the thing that we are most worried about. And, there are some statistical techniques that we can use to adjust for this. One of those is weighting, but, the more wonky this respondent population is, the less representative this is of the true target population, the more we have to rely on statistics. And, statistics is a great tool, but it's not perfect. So we actually worked with the CSU Statistics Lab this past go around, and they did some, like I said, very sophisticated weighting to help us out with making sure that our final population that we end up working with is, representative of the population, of the target population, at least of those with addresses. But we know that that is not perfect. So this is actually our unweighted data. So these are just the raw counts. And you can see very clearly here, like we overrepresent people who are highly educated. We were doing a decent job of, accurately representing those living in poverty, but that was definitely an issue in terms of data collection in 2019, and then again with our follow-up. We got better at capturing the Hispanic and Latina, Latinx population for our 2019 survey. And I think a lot of that was because we did a lot of outreach up front with those communities in terms of actually encouraging people to fill out the survey. But we did not do that outreach at the same level for the summer. And you can see that we did get quite a bit of attrition with that population, which is not what we wanted to see. And again, we then have to rely on statistics to make up for that. So in terms of the actual data that we collect, I did just want to share a few data points, particularly that might be of interest to you all for the projects that you're working on. We don't specifically ask about people experiencing homelessness in our survey, but we do ask questions around housing and housing insecurity. And then we repeated some of those questions in our summer 2020 mid-COVID survey. And you can see that we saw some pretty significant changes regarding need of financial assistance, that increasing pretty significantly between 2019 and 2020, as well as worry about paying for rent or mortgage, increasing quite a bit from fall of 2019 to 2020. So we know that even amongst the population that we survey and then try to represent, we saw some very concerning findings. I think we've talked a little bit about, how to actually interpret these data, but recognizing that we are underrepresenting certain groups and overrepresenting others, so we try to adjust for that. But one of the limitations of that does have to do with when we are looking at smaller subgroups. So when we start looking at specific racial or ethnic groups or certain income levels, there's less precision around those estimates. And of course, with all survey data, this is self-report. So we, assume that people are filling out the survey with best intentions and using their best recall to fill stuff out, but our survey's long and quite frankly, it's sort of burdensome. So I'm sure if I were to fill it out, I would, not be the most accurate representative of my own health. So I did want to note some other data that we have out there regarding, again, some of the topics that you all might be interested in. So this is actually from our community discussion group report that you all helped us in terms of understanding some of the themes that came up during the discussions. And housing was we identified, and you all identified, or this class identified as a key theme in those discussions. So we heard from a lot of different groups and nearly every single one brought up housing, though, the exact perspective regarding housing varied, but there seemed to be a lot of concern over affordability, as well as some of the policies that existed in Fort Collins. And then another piece of data that we have regarding people experiencing homelessness has to do with our survey, where we ask people to answer an open-ended question with what they feel like are some of the biggest health challenges in Larimer County. And certainly comments about homelessness and people experiencing homelessness was a key theme. And unfortunately, many of the comments were quite negative, maybe not surprising, but I know Taylor, who might be on this call, was actually the one to go through and code these comments. And there were some pretty upsetting ones on there. So, I think that there's some interesting data out there about people's concerns about housing and housing affordability, and also their perception of people experiencing homelessness. So all this data, our website, I will admit, is not the easiest to navigate, but you can find many of these reports at healthdistrict.org. But if you're looking for a specific piece of information, your best bet is probably to email myself or Maria, and I can send you our contact information if you want to get in touch with us. And sorry, that was kind of long and wordy.
No, that was great. It's helpful to have that overview, to know what information is collected, how it's collected, some of the really important, limitations like you mentioned. Any questions at this point that anybody has for Suman or Maria while we have them here? One question I have, how many, so it said 143 mentions How many surveys did you collect? I might have missed that number.
No, I don't think I mentioned that. So that was from our 2019 survey. So we had about 2,500 people actually respond. So when you think of it as, when you put the denominator in there, it's not a huge proportion, but it's still, I can't do that math in my head, but, given the vast variety of topics that were mentioned in those comments, I think that was like the 5th or 6th most common.
Yeah, that's what I was going to say is, to me, feels like a large portion.
Yeah.
7 or 8, I don't know, can't do the math either, but
I know.
7% maybe, right? And so, and if it's the 5th most frequently mentioned, that's another piece that makes that a very significant piece.
Yeah, and I'm putting our email addresses in the chat. How long did it take to code all the surveys? So Taylor did the qualitative coding for those. So Taylor used to work with the health district. I don't know if that was clear, but we co-opted her into our team, and then she did the coding, and I have no sense of how long it took her.
It took a while. I actually did the coding for the qualitative data of the discussion group, and that took me like about a week. We use the software, like a week straight. And we use this software called Deduce. I'm not sure if any of you have heard about it, but it's a pretty good qualitative research tool to use. I definitely recommend it. It kept us very organized, but it takes a while. But in doing that, you also get really familiar with the data. So it's helpful.
Yeah, I think I spent probably a solid week, maybe more, going through every single comment, and every single comment that was made, some of them had multiple codes. Like one person could have mentioned 18 different topics. It just kind of depended. So it took a long time, but that being said, I also took my time with it because there were things that I got angry about or was encouraged by, and I it was a very interesting process for me to read through. I think it was like 1,600 comments about health in this community. So
about 1,600 actually wrote some sort of comment.
Yeah, I think, I can't remember.
Yeah.
So then even thinking there, that's closer to 9%.
Yeah.
And more when you think about that.
Yeah. And then we did this follow-up survey again last summer, and I don't know if that was one of the top themes for the summer, but it still was mentioned.
Yeah, it was mentioned. It was in like the top 15 comments, but I mean, of course, other things took over of the summer survey.
In the groups that we helped with in the fall of 2019, do you know if any of the participants were experiencing homelessness? Did you have anybody in the groups?
Yeah, so we actually did a group with the Murphy Center. So we went on site to the Murphy Center and had, I think, about 10 or so people at that one, and Taylor was there, and I remember it was like really snowy, and it was, I think, one of our more interesting groups. And I apologize, I don't think we ended up having any students in that one, just because it kind of came about last minute, and we were in a like physically small space that even pre-COVID we were like, this is too small for the number of people, but it was really interesting and really illuminating, and we kind of were able to contrast, like, some of the comments that they brought up were about quality of care and sort of respect that they felt like they were not getting from medical providers. And then we ended up basically doing a discussion group like a couple months later. It ended up being a last minute thing too, with the exact medical providers that they were talking about, and it was a really interesting experience.
I wonder if that, I think for class, we ended up, I think it was like a 1 or 2 page summary of each of the groups. Do you have something similar to that from the group you did at Murphy Center? And if you do, is that information that could be shared with us?
Yeah, I'm not sure if we have a summary for that individual group, but we can certainly try and dig into our notes and see what we have that can be shared from that.
Okay.
But yeah, I'm sure Taylor can agree. It was a really interesting, and like there are some quotes from that group that still stick in my mind. And someone was talking about transportation, and they were like, well, the number 6 bus doesn't run on weekends, so how are we supposed to get to our appointments? And I think about that every time we're trying to arrange transportation for someone at the IRQ site. And so yeah, it was definitely powerful, and I will try and see what I can dig up.
Yeah, that's great. Thank you for doing that. I think that might be a helpful,
Yeah.
if there's a way to access it, some helpful framing for us
Yeah,
as we're kind of taking our next steps.
absolutely.
What else? Other questions that we have for them before we go? Maria is an alum.
Yes.
So she graduated, what would that have been? Not 2 years ago.
Yeah,
Was
2
it?
years ago. Is
My
that right?
God.
Yeah.
Wait,
Yeah, I guess it'll be 2.
Maria started with us like the week after the discussion groups, actually.
Yeah.
Okay.
It was a
So
crazy
maybe a year and a half.
Yeah, and now we're currently at a vaccine clinic, so we're doing a lot of
Mhm.
public health right now. So, but this is like fun public health.
This
so.
is fun public health.
I had a question, and maybe I just missed this in your presentation, but like with the assessment, is that then fed up into like a strategic plan for the health district, or like your goals? Like what does that look like?
So the health district does do strategic planning every 3 years. The board convenes and does this whole strategic plan. And so that is sort of the first stakeholder for our data. We also do partner with Larimer County Department of Health and Environment. So they're required to do a community health improvement plan every 5 years. And we are essentially their primary data collector for that. So their last CHIP cycle was 2018, and we shared our data with them, and then they do a lot of work with it, and we did presentations with them and other stakeholders, and they identify priorities. So we have an ongoing relationship with them, and then we also work with, another component of both of our jobs is working with community groups and, other organizations and individuals who are interested in using data for their work in some way and are, different levels of data savvy. And we really try and sit down with them and figure out a way to either use our data or help them find other data that's more appropriate for what they're trying to do.
Awesome. Any other last questions before we wrap up? I know, Taylor, we have a specific question for you if you don't mind hanging out. But otherwise, we might, so yeah, if there's any way that we might be able to access that data from the Murphy Center discussion group, that would be awesome. And then if you don't mind, we may have some follow-up questions for you. Thanks for putting your contact info in the chat so we can reach out that way if some other questions come up.
Yeah, please do.
Okay, well, thanks again so much to both of you for your time, Maria. It's really nice to see you.
Yeah, you too.
And then we'll just be in touch.
Sounds good.
Okay,
All right,
thanks to you both. Bye. All right. So we had one quick question. I almost called you MJ because now you're, there they are. Are there times, so we talked about the walking sort of self-guided tour. Are there times that we should avoid going? What are kind of the best times to either go or try to avoid going?
Well, I would say don't do it in the next 5 days because of the snowstorm. Just gonna throw that out there because I think Transport might be shutting down on Sunday. As far as you mean bad times to be at the Murphy Center or bad times to be at Catholic?
Yeah, and just trying not to be interfering with sort of the standard schedule of things. If there were a group of students who want to go together, 2 or 3 students together, are there times that are going to be more interfering?
Well, I think midday is always quiet. And then, but if you were going to the Murphy Center, I would almost encourage you to go between 8 and 10, because that's when there's the most people there and they're doing check-ins and shower lottery and laundry lottery and all those things. So that's when the most hustle and bustle is about. But if you'd like to be more removed and just kind of meander about, I would say midday. And like as far as going to like the rescue mission, because I think I gave you instructions to like the original rescue mission, not the Blue Spruce Food Bank location. You could go there anytime because nobody's there. And then Catholic Charities, I think same thing, midday is good.
Okay. Perfect.